There are only four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. Rosalind Carter. We celebrate caregivers. We listen to and learn from caregivers. We champion the caregivers and offer wisdom and guidance in our new podcast, Care to Listen. We hope you will. In today's episode, COVID and Disinformation, read by caregiver Nancy Murray.
Hi, my name is Nancy. I live in Pittsburgh, Pennsylvania. My husband and I have 3 adult children, all of whom happen to have an intellectual disability. In fact, they all have Down syndrome, and I'm a family caregiver. Today, I want to talk with you about COVID and disinformation. We fear things in proportion to our ignorance of them, wrote the novelist Christian Nestel Beauvais. Those words and insight speak to our response in and through the global pandemic of COVID-19. For some, the news is so dire that they have stopped their subscriptions to newspapers, turned off the news, and avoid social media. Each fear-guided action signals the lack of a trusted communicator and reliable information source. With every inconsistent message, each harried and confused messenger, our fear grows and our frustration intensifies. As caregivers, the beloved ones in our care look to us. To us, they ask their questions, and from us seek guidance. But where are the caregivers to turn? Living through a once-in-a-100-year global pandemic, one can understand misinformation and mistakes. Both are multiplied by the 24/7 news cycle and the rush to be the first to go live with the breaking news and send the post or the tweet that gets shared 1,000,000 times. What confounds and causes our anger is the disinformation around the pandemic, the willing distribution of disinformation driven by efforts to sway public opinion or to hide the truth. The action is shameful anytime, yet in the midst of a worldwide health crisis, it is reprehensible. No one likes living with fear and uncertainty. We need consistency. We need trusted individuals who will convey an honest, consistent message and do so calmly and coherently. In the movie A Few Good Men, there's the often repeated line, "You can't handle the truth." When facts and truth are communicated consistently and from a trusted source, with our best interests at heart, yes, we can. Her seriously ill mother had been admitted to the hospital. Her daughter had been trying to reach the attending physician all day. And when the doctor finally arrived, he called my friend out into the hall for conversation and to provide updated information. Clearly not even close to being the most honest and dignified actions for all involved. However, when my friend, the daughter, came back into the room following the conversation with the doctor, her mother asked her what the doctor said. She told her mother the truth regarding the severity of her condition and the grim prognosis. Later, someone asked her if she ever thought about not telling her mother the bad news. She said that thought never once crossed her mind. This was her mother, she loved her, and honesty and care had always been and remained the best action, in good times and in bad. As the pandemic continues, we need honest, caring, consistent communication, especially when the news is hardest to hear. In those instances, the caring presence found in the caregiver who journeys with us provides strength and comfort. It is that experienced and established trust that we turn to for information. For many of us, we have never heard nor spoken words such as pandemic, quarantine, social distancing, shelter in place, and herd immunity. This adds to the confusion. In the perplexity caused by the disinformation, it is important to make time to explain these terms. A useful guide is to define and describe it in a way that a person can then explain it to others. Often that means using plain words and using metaphors and experiences that are familiar to the person. For example, I love sports. When I needed to understand the diagnosis for my beloved and the time frame, I phrased it in sports terms. So I said to the doctor, "From what you just told me, it seems like we're in the fourth quarter, down by a touchdown, and we have the ball on our 10-yard line with no timeouts." To which the doctor, in a way that I respected then and now, replied, "I would say you have the ball on your 40-yard line. Here are the options." In unsettled times, we need to find a trusted source upon whom you depend. Find a person who you have experienced to be honest and reliable. Make this person your go-to for information. So, who are the reliable sources of information who can assist you in understanding and in sharing the facts? Living in a global pandemic is scary. We cannot allow our fear to control us. For the one who lives in constant fear, everything rustles. Read and research and find a trusted source. Gather the facts, share the truth, be consistent. For the beloved ones in our care, we are their trusted points. Maya Angelou once said, "Hope and fear cannot occupy the same space, so invite one to stay."
Thank you for joining Care to Listen. Care to Listen was written by Sally Jo Snyder. Each episode is narrated by a unique caregiver. Developed resources reported in this podcast are supported by the National Library of Medicine, National Institutes of Health, under Cooperative Agreement Number UG4LM0-12342 with the University of Pittsburgh Health Sciences Library System. The content is solely the responsibility of the authors and does not necessarily represent the official views of the National Institute of Health.